Hi, I'm Dr. Kaila Girvan. I'm a surgical dentist and accredited provider of sedation in Glasgow, Scotland. This is the third video in this series and I wanted to focus on sedation myths, common things that I find patients often think or assume about sedation which aren't true. Myth number 1, sedation is dangerous. If you've watched the previous two videos, you should understand by now that sedation is in fact extremely safe, and in comparison to a general anaesthetic, with sedation you can talk, cough, move and interact during the procedure, and this is because you remain conscious at all times. The drug is given very slowly by a process called titration. Not only does this make the process extremely safe, but it allows us to adjust the sedation to you and your needs. Myth number 2, sedation makes you say silly things or act in a ridiculous way. Many of the patients that come to see me for sedation have seen videos on the internet whereby patients have had sedation and are somewhat out of control, delirious, not making sense. In the UK, conscious sedation is done by using a single drug called midazolam. For this reason, you won't experience these effects. You remain very much in control of what you're saying and doing the entire time, and at the end of the procedure, you will know where you are. Myth number 3, sedation makes you feel sick. I can confirm that nausea and vomiting are not common side effects of conscious sedation with midazolam. Patients often tell me they maybe reacted badly or felt very sick after having a general anaesthetic. They expect sedation to be the same. You will feel tired or drowsy, maybe a little dizzy when the dentist sits you back up, but it's unlikely that you will feel sick, and you certainly shouldn't vomit. Myth number 4, I won't be able to tell you if I'm in pain during the treatment. Again, many of the patients that come to see me who are particularly anxious about dentistry are hugely concerned that once I give them the sedation, they won't be able to tell me if they feel discomfort or pain during the procedure. As I've explained, conscious sedation means that you can talk, cough and move. Therefore, if at any stage you feel uncomfortable, you'll be able to raise your hand so the dentist can stop and address this. Myth number 5, I don't need sedation. I'm not phobic or particularly anxious. A lot of people give me this answer when I initially discuss the option of sedation, bearing in mind I provide surgical and not general dentistry. Sedation isn't just for the extremely anxious or phobic patient, although this is who we tend to use sedation for the most. If you have a lot of dental work that needs to be done, it could be a lengthy or complex treatment plan. It might be something surgical, for example, removal of a number of teeth, or maybe placement of dental implants. Sedation could be an option for you. As I explained in my first video, sedation is extremely safe, it makes you feel very relaxed, and it makes the procedure so much more pleasant. For somebody that may have to be in the dental chair for a number of hours, it's an excellent option to make the session easier for you. Myth number 6, the dose I receive is calculated by my height and weight. A lot of patients have concerns that they may not be given enough of the sedative, or maybe they have concerns about being given too much of the drug. There is no specific dose calculation with midazolam. I can clarify that we don't give a certain amount of the drug based on height and weight. As I explained previously, the drug is titrated, which means that each and every individual patient receives the dose they require. Some people are more sensitive to the drug than others. Therefore, we monitor you clinically, which means watching you as you become more relaxed, and by speaking to you and assessing how you're feeling. We take it from there. Because of this titration process, the dose can be adjusted and tailored to you. Myth number 7, I can't wear any jewellery on the day of the treatment. On the day of your assessment visit, you'll be given specific instructions about what to do and what not to do when you return for your sedation appointment. One of the key things we ask is that you have clean bare nails, and this is so our monitoring equipment can get a clear reading from you. You are not required to remove all of your jewellery, but it's helpful for the sedation dentist who has to place your IV if your hands and wrists are left bare. Finally, myth number 8, what if I forget other memories? When I talk to patients about the amnesic or memory loss effects of midazolam, which happen after the procedure, patients are often worried that they may forget other things and other memories. I can confirm that this is not true. The memory of the procedure from the point the IV is placed onwards is what you will often mostly forget. Your long-term memory is not affected. So those are my top 8 myth busters based on the most common questions I find patients ask or assume about sedation. For the purpose of this video series, I focused on IV or intravenous sedation. There are of course other types of sedation, and I thought it would be useful to briefly run through these. Oral pre-medication is a low dose of sedative, often given in tablet form, which can be taken the night before your procedure and/or the morning of your dental appointment. It has a very mild effect, but for some patients this is all they maybe need. It can help you to get to sleep the night before, lower stress levels for the car journey the next morning, and get you through the door and into the dental chair. It's a very mild effect. Oral sedation is a higher dose of sedative, given as a tablet or drink. It takes more time to have an effect on you because it has to be absorbed and processed by your body first. Oral sedation has a variable effect, which means that 5 people could take the same dose of drug and be affected quite differently. Some may feel very relaxed and quite sleepy, whereas someone else may just feel mildly drowsy. In comparison with intravenous sedation, the level of sedation can't be adjusted. Importantly, you need to be aware that an IV or cannula still has to be placed in your hand or arm with oral sedation once the sedation kicks in and you're relaxed. This will allow us to reverse the sedation with a reversal drug if you become too sleepy. Inhalation sedation, commonly known as laughing gas, or happy air, is a combination of a gas called nitrous oxide with oxygen. Inhalation sedation is administered via a small mask or hood which is placed on the nose, and as the name suggests, it provides a relaxing effect by way of breathing. It makes you feel relaxed, light, floaty, warm. You may experience tingling in your fingers and toes. In comparison with intravenous sedation, it has a much milder sedative effect, but the level of sedation can be adjusted, which is beneficial. It's often recommended for young children from around the age of 4 or 5. However, it's an excellent choice for someone looking for sedation who wants to remember the procedure and doesn't want to have an IV placed. It can be used for patients with needle phobia at the start of the appointment to relax you and allow us to place the IV. And lastly, there is also intranasal sedation, which is when a sedative is administered to you via the nose, often as a nasal spray, and intramuscular sedation, which means through an injection in the arm, as a vaccination would be given, although you won't find this type of sedation in dental practice. In summary, oral pre-medication, intravenous and inhalation sedation are the most common types of sedation that we use in dentistry. However, there are some dental practices that will provide oral and intranasal sedation.